Hi, I'm Dr. Niharika. I head the Department of Emergency Medicine in Manipal Hospital Sarjapur. Today I would like to talk to you guys about what is a brain stroke. So how do you know that this is a brain stroke? It basically means that there is some obstruction to the blood supply to the brain, and because of that there is a neurological problem. Now this neurological problem can be anything and everything. It can start from a minor giddiness, multiple episodes of vomiting, a headache, any visual disturbances like blurring of vision, you're seeing two visions, there can be slurring of speech, there can be confusion, there can be weakness of one side of the face or weakness of the limb, there can be fits, so on and so forth. So any one of these if present, please seek immediate care. And what we do when we recognize a stroke, so there is a mnemonic called as FAST. It's very easy. It also plays a very important role in patient education about the disease. So what is FAST? F is face, A is asymmetry, S is speech disturbances, and T stands for time. So remember, time is very important. Now face, if there is any asymmetry of face, meaning one side of the face is drooping down, patient is having drooling of saliva, that is your indication that the patient might be going into stroke. Asymmetry, the patient might be having weakness of the arms. So patient can't lift up both the arms, has a weakness of the arms or feels heavy on that side of the limb. It can happen to the legs also, lower limbs as well, or one side of the body as well. Speech disturbances basically means there can be a slurring of speech. You cannot understand what the patient is meaning by whatever they are trying to say, or also that the patient cannot comprehend what you are asking, cannot even register, so the answering is very wrong. And time, basically that when did it start. Why the time is important is when you come to the emergency, we send our ambulances, bring you here. What we do in an emergency is that you belong then to a critical zone. And this critical zone is taken care immediately by all the doctors and nurses of the ER. So we check your sugars, we do a rapid ECG, we also activate what is called as a stroke call. So what happens when we activate a stroke call? A call goes to the neurologist, to the anesthesia people, to ICU, to radiologist. So we have our whole team there to help you out. Everybody comes in the ER to do their evaluation. The MRI room and the CT room is ready immediately. If your sugars and ECG is normal, we immediately wheel you to the radiology room. We get a quick CT or a MRI depending on your symptoms, and then we get the patient back. If you have come to us within 4.5 hours, in case of a stroke which has happened due to a clot, we can give you a medicine to dissolve that clot. We ask few questions before we can give you that medicine. We need your consent to give those, and we see a magical recovery from what stroke had caused already, the deficits. So then the patient is admitted in a monitored unit with the cover of neurologists, neurosurgeons, and our intensivists. They give you the complete care, the holistic care. So the emergency team, ICU teams, and our neurology teams with help of the radiology teams give you the whole holistic care in what is called as a stroke ready hospital. So if you find any of these symptoms in anywhere you are, you might be sitting in a restaurant, you might be having a stroll in the park. So in anywhere, if you find anybody suffering through those, please give us a call and we can get you immediate care. Thank you.